New data shows Americans may not be as lonely as we thought from COVID-19 related isolation. An American Psychological Association study found there was not a large increase in loneliness in the early months of social distancing efforts to contain the coronavirus outbreak.
We did find a small increase in loneliness among older adults. So it's like people 65 and over, they did slightly increase in loneliness after the first social distancing guidelines, but this increase leveled off.
Researcher Martina Lucchetti told Newsy those surveyed said they had increased support from others, which helped limit increases in loneliness. Even people living alone with at least one chronic condition who reported feeling lonelier at their baseline said they didn't feel more lonely as stay-at-home orders were issued across the country.
We felt that everyone was experiencing the same thing, and so feeling together in these things would have may increase responsibility to act or reach out to others, even neighbors, maybe for grocery shopping or other way to stay close.
Loneliness isn't something doctors diagnose as a mental health condition like anxiety, which does seem to be growing. A new Ipsos poll found 34% of Americans said their mental health has worsened since the pandemic began. It also found about 1 in 8 Americans said they sought some sort of professional counseling or support since the pandemic began, including 1 in 5 Americans under the age of 35.
A third of Americans are feeling sort of at least some sort of additional anxiety or stress or some other sort of negative factor on their mental or emotional well-being in the last couple of months. When we actually asked people if they'd sought counseling either virtually over the phone, via an app, or in person since the pandemic began, 13% said yes.
Lindsay Thies, Newsy, Denver.